Welcome to Calderdale Royal Hospital maternity entrance. My name is Kate and I'm going to take you on a brief tour of our facilities. So this is the entrance that you need to come to if you are going to antenatal clinic, maternity assessment centre, labour ward or the neonatal unit. So this, the unit is accessed off Godfrey Road, there's parking on street and there's also lots of free parking on site at the moment. So this is the maternity entrance doorway. Now, really important when you get here, please do not smoke outside the doorway because smoking is really bad for our mothers and babies, so please do not smoke here. So when you arrive, you'll be going through these doors, but if you come after 9 o'clock at night, you will find that they are locked. And you'll need to press the button on the wall, which goes through to delivery suite, and they will let you in. When you get inside the doors, if you just get in the lift, to your left hand side and press the button and go up to the second floor and come out by maternity reception, and I'll meet you up there. When you get out of the lift, you arrive at maternity reception. Antenatal clinic is on your left and the maternity assessment centre and labour ward are on your right. Make good use of the hand gel, and if you press the buzzer on the wall for maternity assessment. Hello, it's Kate. Come through. Thank you. Maternity assessment is on your right. Hello.
Hello, welcome to maternity assessment. When you come in to see us, we ask you that you bring your pink notes with you and drop them here at the desk. When you've done that, we ask that you come round into the unit with us. So we'll bring you down to the waiting room at the end. We ask on your arrival that you bring us a urine sample. There's a toilet just at the end. We aim to see you within half an hour of arriving, and we'll call you into one of our cubicles here. So reasons that you may need to come to maternity assessment. We see ladies from 16 weeks of pregnancy, so that would be for reasons like changes in your baby's movements, any signs of labour, your water's breaking, bleeds, any other concerns. We're here 24 hours a day, 7 days a week. The phone line is always open, so just ring us with any concerns, questions, and we're happy to help and answer. And if we need to see you, we'll ask you to pop in. So these are the cubicles that we see you in. There's a couple of pieces of equipment for monitoring baby, checking your well-being. If need to, we'll ask one of the doctors to come and see you. They will see you as soon as they possibly can, and then we'll make an ongoing plan whether we need to see you back, ask you to stay for admission, or follow up as normal with your community midwife.
Thank you. Shall we have a look in the waiting room?
Please come to the waiting room. So in the waiting room, we've got a couple of birthing balls for ladies that are coming in for labour assessments, comfortable seating areas, there is a TV and water fountain.
Lovely, and a nice view out of the window. We'll go from Mac to labour ward. Hello.
Hello, my name's Shanice, this is labour ward. If you want to follow me, I can show you what rooms we've got.
Thank you.
So just round through, there's more room. And this is labour ward.
Okay.
So these are all the rooms that we've got. We've got more birthing balls there, as you can see.
Lovely supply of birthing boats.
If you're not in the room with you, we've got lots of monitors for you to keep them close eye and everything.
Hello. We're following.
Lots of rooms. Make yourself a cup of tea if you want. Or we can. And then all our rooms are pretty similar, nice and spacious. So a lovely view of Halifax. So you won't mind staying in. And then you've got the monitors here, which aren't too scary at all. They're there to keep you and baby safe. You've got a nice space. Your partner can be here when you're in labour. And then all our equipment is stored safely away in here. And as you can see, lots of space for everything. And you've got your own bathroom just in here.
Look in the bathroom.
You can do reasonably what you want with the space. If you want to bring candles, anything you want, obviously got birthing balls, you can make it as cosy as you want.
Welcome to Calderdale Royal Hospital. This is the main entrance, and this is where you need to come if you are planning to have your baby at Calderdale Birth Centre. The birth centre is accessed through a little pathway to the right of the main entrance. If you are dropping off somebody who's having a baby, you can park here for about 10 or 20 minutes while you get all your things inside and then go find somewhere to park. But there is a big car park in front of the hospital and plenty of parking at the moment. So this is the entrance to the birth centre, and to access you need to press the buzzer on the wall. And there should be somebody. Hello!
Hello, welcome to Birth Centre. My name's Michelle. Come on in.
Thank you.
We have 7 rooms, 2 of them which are birthing pools. Would you like to come in? All our rooms are en suite. Usually 2 hours after giving birth we would change to another room. I'll show you down there. This is our reception with Carol, our boss. She's in dark blue. Pinks are midwives, and light blues are health carers. Come on in.
Hello, welcome to the Fours. My name is Emma Bowman. I'm the Deputy Ward Manager for the Fours, so just thought we'd come and give you a little tour around, make you familiar with everywhere. So first we go to Ward 4A. So this is where you come after you've had your baby, or if you're in being put on the list for elective caesarean section. So if you follow me. So, here is the main part of the ward. You'll find the nurses station here, where you'll find some midwives, student nurses, healthcare assistants that are always here to help. You come to this bay here. So this is typical of a bay that you would come to if you come in for elective caesarean section or after you've had your baby. So you've got your own bed space, cot for baby, nice views of Halifax. And then as you come out of the bay, either side of the nurses station, you'll find 2 patient bathrooms. One's got a bath in it and the other's got a shower. And then you'll find as you come down the ward, there's lots of information on the walls in terms of your recovery, lots to do with feeding, postnatal mental health, lots of stuff to keep you occupied whilst you're here. Now moving along, we come to Ward 4B. Now this is where you come for your induction of labour, or if for any reason you need to come in and stay in the hospital whilst you're pregnant. So if you come down, we have another patient bathroom here, and in here's a lovely big bath to use during your induction if you find that you need a little bit of a dip. So when you come in for induction, you get your own side room. So here's one of our side rooms here. You'll find your own bed, chair and table. Then we've got a monitor for us to monitor your baby. And then you do have your own bathroom and shower. And in every room you'll find a little birthing ball. So as you come down the ward, you'll find that pretty much the layout is the same everywhere that you go, and you'll find the nurses station again in the middle with one of our midwives, Emily. Hello! Either side of the nurses station you'll find 2 patient bathrooms, one with a bath and one with a shower. And then opposite the nurses station is our day room. So it's a great room to come, get your meals, sit and relax, have a change of scenery, get yourself some fresh water or a tea and coffee and a biscuit. So now we're at Ward 4D, which is transitional care. Now this is a ward that you'll come to after you've had your baby, just in situations where your baby might need a little bit more input. For example, if baby's a little bit early, this is where we try and put you on here. Alright? So this ward's slightly different than the other 2. The ward consists of fully side rooms. There's no bays on here, so each room has its own toilet and shower. Again, you'll find the midwife station in the middle. We've got midwife Michelle and family support worker Jane. So if you come along, we'll show you into one of the rooms. So again, it's a very similar layout. You've got your own bed, cot for baby, and then your own shower and toilet.